Hello, my dear students. This is Dr. Vishnupriya, Associate Professor, St. John's Medical College Hospital, Bangalore. Today's topic is on menstrual irregularities. This is once again a very common and basic topic. We all should have a clarity about it. And I would like to discuss the menstrual irregularities under various headings. So before we start about the various irregularities of menstruation, we should know what is a normal menstrual cycle and what it is about, how to take the normal menstrual history, what are the various abnormalities of menstruation, and what are the various causes of the menstrual irregularities. So what are the various components of the normal menstrual cycle? So when I say normal menstrual cycle, it has 5 components, mainly the duration of the cycle length, that is 28 plus or minus 7 days is considered normal, and the quantity is equal to or less than 70 ml, and the duration should be up till 5 days and maximum should not exceed 7 days, and with no clots. If at all it is there, it should be very minimal and very small clots and associated with the mild pain, which is spasmodic. So these are the 5 components of the normal menstrual cycle. So when I say menstrual history, so we need to add even age of the menarche at which the girl attains the menarche. And as already we have discussed about the cycle length, it varies somewhere between 28 plus or minus 7 days. Duration of bleeding, quantity of bleeding, and last menstrual period. These are the various components, that is, those are the 5 components that we discuss about the under the menstrual history. So which is the very common and the basic concept that you have to understand when you write a gynae case history. So what are the various, once you understand about the normal menstruation, so what are the various menstrual irregularities? So initially, first thing will be the irregularities of the cycle length. So when I say 28 plus or minus 7 days, it is 21, it extends from 21 to 38 days or 35 days. So your textbook, that is short textbook, in 16th edition, he has taken cycle length less than 24 days and 35 days. And in 18th edition, it is different. It is up till 21 days to 38 days. So adding to the confusion, there are various numbers given, but the traditional teaching is 28 days plus or minus 7. That is a traditional teaching and it's a standardized thing. So you can remember as a 28 plus or minus 7. So when I say cycle length abnormalities, it could be 2 frequent cycles, that is polymenorrhea, wherein the cycle length is less than 21 days, and oligomenorrhea, which is infrequent cycles, where the cycle length is more than 35 days. So these 2 abnormalities are the cycle length abnormalities. Then coming to the duration or quantity of flow. So when I say the normal duration and the quantity of flow, which we have already discussed, if the quantity is increased, either the quantity is increased in terms of ml, that is more than 70 ml, or the duration of the bleeding is exceeding more than 7 days with a normal cycle length. So this is the prerequisite. At a regular cycle, the cycle length should be at regular interval, but with either increased bleeding or with the increased duration, either increased duration or increased flow is called menorrhagia. So menorrhagia has 2 components. Either one is enough to call it as menorrhagia. If the lady has say 8 days, 10 days bleeding, but she has changes hardly 1 to 2 pads per day, but it's still menorrhagia because the duration is more than 7 days. And if another patient has 5 days bleeding, but the quantity of bleeding is more, so again it is menorrhagia. This is how the menorrhagia is described or defined. The cycle length is constant here, it doesn't change. And then, so what is hypomenorrhea here? Hypomenorrhea. Hypo is a decreased or scanty amount of bleeding. And what is metrorrhagia? Metrorrhagia is intermenstrual bleeding that can happen sometimes in cervical polyps or endometrial polyps with the normal menstrual cycle length in between. So intermenstrual, in between 2 cycles, if there is a spotting or if there is a bleeding of some duration, it is called. So intermenstrual bleeding, and which is irregular also. It is not regular. It is called metrorrhagia. What is menometrorrhea? Anywhere meno means increased flow. Metro means irregular. And so this type of bleeding, which is irregular and heavy bleeding, which occurs between the cycles, is menometrorrhea. So meno means always heavy bleeding, metro means irregular bleeding, and this is the irregularity. So these are the various irregularities which are discussed. And then again, this is the same according to the 18th edition. So the other components remain same except the cycle length, which is varying in each textbook. So to reduce the confusion, you remember as a 28 plus or minus 7 days, which is equivalent to 21 to 35 days. Any cycle which is less than 21 days is polymenorrhea. Any cycle length more than 35 days is the oligomenorrhea. So frequent menstruation, poly, and infrequent menstruation is the oligomenorrhea. So these abnormalities or the normal cycle is depicted in this picture. So when it comes to the rhythm, that is cycle length, again what I described before, which is depicted in the picture. So oligo, so cycle length is more than 35 days. Poly, it is less than 21 days. This is the rhythm of the cycle. When it comes to the amount, that is hypermenorrhea or menorrhagia, more than 70 ml, so more than 70 ml. And when it comes to the hypo, always it is reduced bleeding, that is scanty bleeding. So these are the various menstrual irregularities. Hope you understood the various abnormalities. And these are abnormalities. The reasons or the causes are described under a palm coin, that is the mnemonic that we use for the abnormal uterine bleeding. The various mnemonic or the causes are described under the palm coin, which we will discuss in the next class under AUB. Thank you for patient hearing. We'll meet in the next class. Thank you.